Hi, everyone. It's Karen Anderson here with aortichope, and so excited to have tonight's live event. It's the next to the last event of Aortic Disease Awareness Month, and this is always a very popular event for the community. And this is the Navigating Life with a Disability. And we have representatives from Doherty, Cella, and Keane. We have Chris Doherty and Barbara Mountain here with us. And I'm going to let the two of you take a minute to introduce yourselves before we really jump right into the thick of what's a very important conversation. Take it away, one of you.
Okay, thank you, Karen. I'll go first, Barb.
Okay.
My name is Chris Doherty. I'm the Doherty and Doherty Cella Keane. I'm an attorney. Doherty Cella Keane just celebrated, or will celebrate in November, our 26th anniversary. We were supposed to have a big party last year to celebrate that, right? But of course, we weren't able to do so, and we're not sure we can do one this year either. But at some point we will celebrate that. And my background is I used to work for the Social Security Administration. I was a claims rep taking disability claims, and I did that for about 5 years. And I was going to law school in the evenings while I was doing that. And then I kind of put the two of them together and been representing people, getting them entitled to Social Security disability basically since then, along with my partners, Laura Cella Donovan and Martin Keane. So our focus is on representing folks, and the word of the title in tonight's event is called Navigating, and that's what we like to do. We like to navigate people through this process. And it's funny you said that, Karen, and you named it that way, because if you looked at our website, you would say that's what we talk about, that navigating the process, and we have the boat motifs and the whole thing on there. But I'll turn it over to Barbara Mountain and let her talk about herself.
Thanks, Chris. Hi, I'm Barb Mountain. I'm the National Director of Business Development with Doherty Cella Keane. My background is also with Social Security. As a matter of fact, Social Security has been my whole life. When I graduated from college, I went to work for the Social Security Administration, where I was a social insurance specialist, which means I had expertise in both Social Security law and Supplemental Security Income. When I was with the administration, I also was involved in trainings. I was out in the community doing lectures on Social Security, and I really, truly enjoyed what I did. When I left Social Security, I went to the insurance world, and that's where I worked with long-term disability insurance, helping their disabled population obtain Social Security benefits, before I transitioned to Doherty Cella Keane, where I now work with an attorney firm and helping our claimants obtain Social Security benefits. So really, Social Security is in my blood. It's an extremely important program. It is complicated. People do need help going through it, and I'm really proud to work with Doherty Cella Keane. We help a lot of people obtain benefits that they definitely deserve.
And I will say it is a very challenging process. So you do have a population of individuals in this community, or as we've opened it up to anybody that has a medical condition that could be watching this, that we're working. And then all of a sudden you have an illness or injury occur. And with larger companies, you're put on short-term disability, which then will move into long-term disability. And I would guess that tends to be a lot easier because you're automatically referred to a law firm typically that then is there to help you through the steps. I had no clue how much I was going to be helped until I was fully invested in the process. But there's a whole other community out there that tried to attempt to begin this process and really struggle. And I think we should back up and start with what really classifies and qualifies somebody as being disabled and ready to look into their benefits.
Sure, I'll handle that. The actual definition of disability that Social Security utilizes is you must be unable to do any what they call substantial gainful activity. That's their term for work. And you must have, either by a physical or mental impairment, be unable to do any kind of substantial gainful activity. And it has to be expected to last 12 months or more. So it's not a short-term thing. Sometimes people could be in a bad car accident and maybe be, unable to work for 6 or 8 months. They would not qualify for Social Security disability. So the key thing is it must be expected to last more than a year or more, or God forbid, result in death before that. Really, the way to look at it is you must be unable to do not just your past job, but any other job that you could do by way of your, considering your age, your education, your past work experience, and your residual capacities you have after your impairment.
So when you say that, I'm going to just ask a quick question. When you say you have to be able to no longer perform any job. If you were somebody that was a skilled laborer, are they expecting you to now take a position doing accounts receivable or administrative, something that you've never done before, and vice versa?
Yes. So as you can see, it's a strict definition. However, once you attain age 50, they don't expect you to do jobs you had no experience in before. You must have, in order to do a job that you didn't do before, you must have skills that'll easily transfer over to those jobs. So basically, a way to look at it, the younger you are, in order to get entitled to Social Security disability, kind of the more disabled you have to be. The older you get, maybe the less disabled you have to be. If you're unable to do, if you're 60 years old, unable to do your life's work, there's a pretty good chance you're going to get disability because they don't expect someone at that age, that what they call advanced age, to easily and readily transfer to other work, especially if they hadn't done it.
Okay. So
one thing I want to point out, because people get confused by this. So they hear about Social Security, it has to be a condition that's going to last for more than 12 months. And they think, well, I can't file because it hasn't lasted 12 months. You can file the day you become disabled. Just medically, it has to be supported. That's a condition that's going to last for at least 12 months. So you can file whenever you want, but what they're looking at is it a condition that's going to last for at least 12 months in terms of you getting awarded or not?
And to clarify to the community that's watching, an aneurysm may or may not last 12 months. That may be fixed before 12 months. And someone with a dissection, it is going to last longer than 12 months because it's there unless you had your aorta replaced. But it's not necessarily that you had a dissection or that you have Crohn's, which is not curable. And that is clearly going to last for the rest of your life. It's what is causing you, because of this disease, what is it doing that's preventing you from working? Well, those symptoms are actually the things that they're wondering about that may or may not last for a year. Is that correct?
Right.
Yeah. No, that's a great point, Karen. And often some people will have a main impairment that makes them stop working, but then oftentimes you develop secondary impairments that are equally as disabling, perhaps. And a lot of times, what happens when people are unable to work, they become depressed, right? They're not doing what they used to do. They're not supporting their family in the way that they were accustomed to, and they still have a major physical problem. But they also can sometimes develop, psychological problems along that. So when we represent someone, we don't just go with what their initial impairment was, but what else is going on as well. And we kind of put the whole thing together because often it can be a combination of impairments that could render a favorable decision.
Now, what happens if somebody becomes impaired and they can no longer work 40 or 60 or 80 hours, whatever they were used to doing in a week, but they've been cleared to work 10. So now they have a significant decrease in income. Are they eligible for any of that difference?
Yeah. You want to go with this one, Barb?
Sure. They still have to be under what's referred to as substantial gainful activity, and that has a dollar amount associated with it. This year, it's $1,310. Is that right, Chris?
Correct. 1,310. Yep.
Yeah. Okay. Double checking myself. So even though they, have reduced significantly, and maybe their income now is only 10% of what it was, if they are still able to work and earn more than $1,310 per month, then they would not be eligible for a medical decision, and they'd be actually denied technically because they have not yet met Social Security's definition. Now, sometimes people are working and maybe they're being subsidized. Maybe their employer is being really kind and paying them, although they're really not earning that amount. They can, it takes a little more work, but they actually could still apply. Social Security would have to prove that the work is being subsidized or not really earning it, proving that they truly can't earn more than that. Those would really be the only type of exceptions to that substantial gainful activity rule.
Okay. One of the things that we at aortichope try to explain to the community is this is not really a process that anybody wants to undertake on their own. And this is, I'm going to have you explain it from soup to nuts, because it's not something that we also need to pay an attorney up front for either, if I understand correctly. So people get concerned, I don't have money to pay hundreds of dollars an hour to have somebody do this work for us. So I would love for you to really explain to somebody that's out there listening now, who's just been sitting, just, financially, they're just distraught. They know they can't work and they're not sure what to do. How can they begin this process, and what does it look like for them?
Yeah, well, there's a lot there in that question.
I know.
You can certainly file on your own, and you can file through Social Security's website. It's www.ssa.gov. However, let me tell you the story of my brother who had a situation where he had to apply for disability, and he was a college professor. And as he's doing it, I said to him, hey, you know, that's what I do, right? He's my older brother. I can do this for you, and I'm not going to charge you, by the way. You're my brother. And he said, no, I got this. I'll do it on my own. And I said, okay, you know, whatever. And so he applied. About 2 weeks later, he called back. Goes, geez, Chris, I thought I applied on my own. I thought I had to. I'm sending the same questionnaires back, and then I got a denial letter. It really wasn't a denial letter, but it looks like one. And anyway, so he was all confused. And I said, this is why I'm doing it, so let me do it. And we took it from there. So by all means, you know, you can apply, but, you know, the Social Security is a large governmental agency. And I can say this because I used to work for them. They can mess things up. You know what I mean? It's hard to deal with a governmental agency when you're feeling good. I know here in Massachusetts and other states, you know, trying to go to the, you know, motor vehicle agency, it's a whole day off. And, you know, it's the same thing if you with Social Security, if you're not feeling well, you're going to get kind of knocked around by the bureaucracy. But anyway, so the way the fee works, because you touched on that a bit, it is what's called a contingency fee. In other words, there's no fee up front. There's no fee payable unless not only ourselves, but any attorney gets the benefits awarded. And what Social Security does, they look into this and they want to make sure attorneys aren't overcharging claimants. So what they'll do, they have to approve any fee that any attorney will charge. So there is a standard fee agreement which calls for the fee to be 25% of the past due benefits up to a cap or a maximum of $6,000. And what will happen is Social Security will take that out of your past due money and send it directly to the attorney. So you don't have to worry about sending any money up front or paying it later. So the government will handle that, and they'll make sure everything is done properly, and that the attorney basically did their job that they were supposed to. And in terms of how the process works, Social Security unfortunately tends to deny most people who apply the first time. It's called the initial application process. They only approve. It just went up this year in the high 30% of people who get approved the initial level. So most get denied. The next step of appeal is called the reconsideration. It's another paper review. You don't really see anybody, and no one sees you. And that reconsideration, they only approve about 12% of those, so even less. Then when you get your fairest shot, or most fair shot, is at the hearing level, the next level, where you used to go in person before an administrative law judge. Now you can either do it by video, kind of like we're doing tonight, or most of them are done by telephone. And you go before an administrative law judge, and statistically, nationally, about 45% of those cases are approved. So as you can see, you got to really stick with it, because often Social Security will deny the case. And if you appeal, you get discouraged again. And half of our job is to tell people, hey, don't worry about it. Let us handle that. You worry about feeling as good as you can. Let us take care of all that paperwork. We'll fill it all out for you. We'll deal with the doctors. We'll deal with Social Security. You don't have to do it. And then hopefully we'll carry them through to the end of the process.
But one of the most important things you just said is that you'll take care of the paperwork, because that paperwork can be like an inch thick. And when you are in this community, and some people have had small strokes, some of us can't even remember the first question by the time we get to 5, because that's just what happens to us after heart surgery, what's called pump head. And then we become very exasperated and full of anxiety as we're having to really face the reality of the answers to these questions, that you can't bend over, you can't stoop down, you can't stand for long periods of time. And it can really invoke a lot of emotions, not necessarily positive. So that's another thing I need the community to know, that this can be very tough, but the reward on the backside of the end will be worth it. But it is so much more beneficial to have somebody in your corner helping you to process all of this, because it's a lot as a survivor and a patient to process.
Right. And I think most attorneys take pride in taking that burden from you. You know, you have a lot going on when you're unable to work. So, hey, we do this every day. Let us deal with filling that paperwork out. Because, you know, like you said, there are reams of it. And so we say paperwork, it's all online now, but the same thing. You know, there's a lot to be answered there. And there, you know, there are some other things going on with Social Security now that is making it more frustrating. And Barb, do you want to talk about that? Some of the delays that we're seeing at the initial and reconsideration level?
Yeah, so historically, Social Security has never been a speedy process. It takes a long time, which is a reason you do want to often file sooner versus later, because it can take so long to get to that hearing level where you have your best chance of being awarded. So historically, at the initial level, you would get decisions around 3 to 6 months, and at the reconsideration level, similar timeframes, 3 to 6 months. And then at the hearing, historically, it was really, really long. It could be 2 years or 3 years even. That was the long point. Well, there's been a change, and Social Security has actually really brought down that time frame to get the hearing. We're no longer, our hearings taking 2 to 3 years. Sometimes we're getting a date for a hearing within 3 to 4 months, probably more on average as we're talking maybe 8, 9 months. But what we've seen the change, the biggest change that has come, and it's really come about to a large degree because of COVID and having everybody have to work from home and Social Security not really being able to adjust as well as smaller organizations to that, is we've seen a huge backlog starting at the initial and the reconsideration levels. And unfortunately, that affects the vast majority of people. I mean, everybody has to go through that initial level. So what they're finding is that it's taking much, much longer. We're seeing cases that sometimes at the hearing or the initial level are taking 9 months or even a year to get awarded. So definite delays at that first level and that second level. Recently, we ran some numbers and we found out that applications haven't increased. And in some cases, applications have actually gone down, but yet their pending workloads are up 36% at the initial claim level. So they're just not able to get to the work. A lot of it is understandable. Early on in COVID, people weren't seeing doctors. People weren't able to get medical records. So there was kind of a delay because if you can't get the medical record, they can't make the decision. So that was really affecting things and making sure that they had up-to-date medical records and they could do consultative evaluations. But really more so, the delays have come on Social Security's ability to process mail. Believe it or not, they have to see some documentation. They need to see birth certificates or marriage certificates for some types of benefits. And they're just not able to nimbly handle the vast quantities. If you can imagine millions upon millions of documents coming into Social Security that they don't have the staff in the offices to scan and upload quickly, that's slowing things down as well. So it's really more of an administrative issue, I think, that's causing the problems. And it's going to take a long time to dig out of that when they're eventually able to do so. So it's not great news in terms of the timing, and it only reinforces the fact that, you know, if things don't look good, even though you want to go back to work, and that's everybody's goal, sometimes it can make sense to file and then hope you go back to work and you just withdraw that claim versus waiting and then getting that much further behind the process because of how long it takes.
Right. Wow. That's a significant. I thought it was bad when I applied 7 years ago. I felt like I was waiting forever. So that does make things very challenging for people. Now, what if somebody does attempt to go back to work, but then they realize, you know what, I'm getting beaten down again. I'm getting sick again. I just can't do it. Does that help in their favor? Does it impact the situation at all?
Yeah, I always, when I'm representing someone and they say, hey, I'm thinking of going back to work, I always encourage them to do so. Because, okay, if they can go back to work, then great, right? That's the goal, right? You want to get back to work. And then if it's successful, well, then great. You don't need this disability. But, you know, if you try and it doesn't work out, that's okay too. Because what it does, it kind of further bolsters and enhances really their credibility if they have to go before, you know, Social Security in general or a judge in particular down the road. Because many times the judge will ask that, have you tried to do any other work, maybe, you know, since then? And if they said, well, yeah, I did an easier job in my shop or whatever, but I couldn't even do that, I only lasted 3 weeks, it kind of shows that, hey, they tried and they couldn't do it. So people shouldn't be afraid of doing that. And Social Security is very liberal in the sense that they want to really encourage people to try to go back to work. Once you're approved for benefits, they have something called a 9-month trial work period where people can attempt to return to work and collect whatever they're getting from their pay and their disability check each month for up to 9 months. And then kind of after that, they say, okay, what is it? Are you going to keep working? Or are you still disabled? And when people are applying for benefits, Social Security forgives up to 6 months, what they call an unsuccessful work attempt. Like if someone tries to do either their old job or another job, but has to stop due to the same impairment they had before, they're going to say, well, we're not going to count that attempt against you. So I tell people all the time, hey, you know, try to give it a shot. It shouldn't hurt you. And if you work, great, and it works out, you go forward. If it doesn't, well, at least it's more evidence that you can't do it, you know, every day.
I'm glad that you brought that up because we were going to get to that point because that was brought up in our last conversation and it got a lot of buzz. For individuals who have been approved and are already receiving benefits, I know you had mentioned the $1,310, the $1,310. If someone wants to try to work or just wants to supplement this disability money a little bit because they can work a couple hours a week. How does that whole situation work again? At what point are they actually triggering Social Security now to really, I guess, pay attention, for lack of a word? Meaning, if I wanted to sell some art online and I'm making $50 here, or maybe I'm making $100 in a month, is that something that I really need to? I've started some kind of countdown. So if you can explain that process a little bit, I would really appreciate that.
Sure. All right, I'll take that one. So as Chris mentioned, anyone who's on Social Security disability gets what's referred to as a trial work period. And that allows an individual to go back to work and attempt to try it without any risk whatsoever to their benefits. Those 9 months, they can earn anything they want. They could get a job making $10,000 a month. They get their $10,000 in earnings, plus they get their full Social Security check. Now, after that 9 months, that's when they enter a new period of time called their trial work period. It's called their extended period of eligibility. It's 3 years, 36 months. And anytime during the next 36 months, they earn over SGA, that $1,310, they're not due their check in its entirety. Any month they earn under $1,310, they are due their check. So really for the next 3 years, they might be in pay, in work suspense, in pay, in work suspense. And that's only if they're going over $1,310. Now, you asked about the person maybe earning less than that.
Mm-hmm.
They can earn that in basically forever, because you're not triggering the not being eligible for a check until you earn more than whatever substantial gainful activity is in the current year. SGA does change annually. It doesn't go up by a lot, might go up by $30 a year or so. But right now it's $1,310. So if they were doing something like $500 a month, they could continue to do that forever. It could potentially trigger a work CDR, which means a continuing disability review, where they're going to go in and say, hey, this person's working. Have they gotten better? But with earnings that low, very, very unlikely that it would. And again, you're only going to come off Social Security if they were to do a medical review as if you showed substantial improvement. If your condition is the same, that is not enough, or even a little bit of improvement. That's not enough to have you come off of Social Security. So really, you can do those jobs, you can do those little bits and pieces, and it's not going to affect your Social Security benefit. It's just going to supplement your income.
And for people in this community who are already struggling half the time to have the energy, the stamina to leave home, some people, now with COVID, this might not be a horrible time to look into seeing if you can earn some money with your favorite hobby, seeing if you could take a job with an organization that lets you work remote. There's nothing wrong with trying it. And I think what that just does, what you just spoke about, really helps put to bed the stigma or the rumor mill of, oh my God, if you work, they're going to take away your money. And I think that's just what everybody thinks, and they don't realize it's really not the case. It is encouraged to try, and all of us should be trying. That always is the goal, as Chris said. We just might not be able to, with certain restrictions, go back to the life that we had, but that doesn't mean that we can't earn something in addition to the disability.
Yeah, one thing I want to mention on that is sometimes people say, oh, 1310 is the limit. Okay, I'm going to earn 1,305 every month. Mm-hmm. I'd be a little careful of that because it almost looks suspicious. You know what I mean? That could draw interest by Social Security. Also, if you're getting paid on a weekly basis, some months have 5 weeks in it, some have 4, mm-hmm. and you might think you're going to be under, but when the Social Security looks at it by the month, you might really have 1,400 one month and then 1,200 another. So I would be careful if you're trying to get a little too cute with it, and just stay right under it. If you're going to work for an organization or someone that can work with you, maybe you can suggest, hey, pay me on a monthly basis and not on a, every 2 weeks to avoid that particular situation, which sometimes can come back to bite people if they're just.
That's a great point. Now, one of the things we did not touch upon that I'd like you to would be Medicare versus Medicaid. So what are the differences? We've done this before. And what's the qualification, the quarterly, the hours worked, the earnings, all of that? Barbara, you do such a great job explaining all of that every time. So could you do that again for us, please?
Go.
So Medicare is what you get for being on Social Security disability. And you're entitled to Medicare 2 years after your date of entitlement to benefits. So whatever date you're first due your first check, 2 years later is when you're going to get your Medicare entitlement. Medicare is made up of Part A, which is free. There's no cost to that. That's your hospital insurance. Part B is your doctor's insurance. And then there's also a choice in terms of prescription drug coverage that you might choose. Medicaid is actually based on needs. So it's having people with very low income and low resources that are eligible for it. And there's different guidelines for what you need to qualify for Medicaid depending upon your state. I don't know if you have anything else to add in terms of that, Chris, to the Medicaid piece.
Yeah. Well, we can always take a step back further. There are two disability programs that Social Security runs, right? The definition of disability is the same that we went over earlier, but one is SSDI, Social Security Disability Insurance. That's the one, and you touched on it, Karen. We said that's when you have to work and pay in the quarters of coverage. So that one you have to work and pay into it. And once you've done that, you've worked, you have to have worked at least 5 of the past 10 years to qualify recency of work. But you also have to be what they call fully insured, which is essentially 10 years of work. I'm talking about people over age 30. For people under age 31, they have a special insured status that they look at for that, and it's more particular. So basically for that, if you're working half the time, essentially you'll be entitled. So with that Social Security disability insurance, that's the one you have to work and pay into the system. That's the one where you get entitled to the Medicare that Barb talked about 2 years after you're entitled. Now with SSI, Supplemental Security Income, don't you love the way they name these all the same? Medicare, Medicaid.
That's where I got confused. Yes.
Exactly.
That's another disability program. The same definition of disability is utilized, but as Barb mentioned, you have to be under some very low income levels, like almost welfare eligible. You can't have any savings in the bank, et cetera. Under $2,000 in resources you have to qualify for that, and no income essentially. And with SSI, you become entitled to Medicaid, which is administered through each state. But if you're entitled to SSI through the federal government, you qualify for Medicaid through the state. And so that's kind of the two differences between the two programs for disability under Social Security, SSDI and SSI, in the two health programs, Medicare and Medicaid.
And if you haven't worked enough of those quarters, if you haven't paid into this, then what happens?
That's when you might be eligible for that SSI, because you don't need to pay quarters to be eligible for the SSI.
Oh, okay.
Often what happens is if younger adults who are 18 and 19, they haven't had a chance to really work, if something happens to them, they often are eligible for SSI, but not necessarily SSDI, because they haven't paid into that. Okay. So that SSI is kind of a catch-all program for people who might not have the chance, or for whatever reason haven't paid into the program, SSDI program.
Yes, SSI is for the disabled, the blind, and the aged who have very, very low income and very low resources, who did not pay into Social Security enough to earn a substantial Social Security benefit.
Okay. The other thing I wanted to ask about that I know people get nervous is when they're in the initial phase and then reevaluating. So when initial phase, and I'm really happy that you mentioned this in the last conversation too. Sometimes people are requested to go see a doctor of Social Security's choosing. I don't know if they went for a physical, because I didn't do that, but I was told to go to see a psychologist that they chose, which I found very disturbing for myself, because I didn't know this person, and now they're going to ask me all these questions. And what if an ambulance goes by and I hit the ground? Are they going to think I'm certifiable? I didn't know. I was very, very anxious, and maybe I passed better because I was visibly anxious. But they do make this request. And so what can people do with this request in the initial stages?
Yeah, Social Security is supposed to go to your own doctors first, right? But sometimes they'll write them. If they don't hear in 2 or 3 weeks, they're going to set up an exam. But you can insist that your own doctor perform the exam. They don't like when you do that. Many times your own doctor won't want to do it because they tend to underpay these doctors. They're often with these mills and they don't get paid much, and your own doctor is probably too busy to do this. But if you have a good relationship with your physician or physicians or psychiatrists or psychologists, you want them to, present your case, if you will, to Social Security. And I'm not saying they have to present your case, just give the medical records and maybe a little summary of them for it. And if they do that, then you probably will not have to go to any type of consultative exam, as they call them. Sometimes if people don't have a doctor, they'll set them up. Or if the doctors are not responding for whatever reason, they'll set one up. Sometimes if they see in the medical records that someone might be in for a physical problem, but maybe they're taking Prozac, but they don't see a psychologist, well, they might want to set up a psychological exam just to see how they're doing in regards to their mental status, whether it be depression or anxiety or whatever it might be. So those tend to be the reasons why they'll do that. But often we'll, when we see that, we'll try and insist like, wait, have you talked to the doctor? Let's get on board with the doctor. Maybe Will can give the doctor a little push to if they haven't supplied the necessary evidence. And that could often obviate the need for going to what we call a CE, consultative exam.
So one of the things I know you would recommend is if you're going to begin this process, I think it makes a lot of sense to let all of your physicians know, hey, this you've probably been discussing it with your doctors anyway, but to definitely let them know, I'm going to start this process. Heads up, you're probably going to be receiving a lot of paperwork or phone calls. Can you, handle this?
What I would recommend they do is before you start the process, go to the doctor and say, hey, listen, I'm thinking I might have to apply for disability, kind of off the record. Would you support me for that if I did it? The reason I say off the record, because sometimes doctors are busy and they'll write down, claimant in here looking to file for disability. And that can look bad, 2 years later looking back. And it's an offhanded line or something they put in the notes. But so I would say off the record, if I were to apply for disability, would you support me? If they say, yes, absolutely. Okay. Then I think I'm going to apply. And if you could, make sure when you hear from Social Security, please respond in a timely manner. That would go a long way.
Okay. And then we sometimes face being reevaluated depending on age and situation. And I know I had gotten paperwork a few years ago before I had turned 50, looking to potentially do reevaluation. I learned very quickly from your organization that I did not need to do anything, even though I went and had all of my medical records printed in that prior 2 years. And I mailed it anyway, because I was really concerned that they weren't going to get everything. And not everybody has to do that, or even not anybody really, I guess, needs to do that. But can you talk about the reevaluation process? Who does it happen to and how often?
Sure. Well, everybody actually is going to get reviewed at some point, or is supposed to be reviewed at some point. Social Security requires that every type of condition has a diary put on their claim of when they will come up for re-review. So even people with permanent conditions that we know are not going away will have a diary date. The dates are either going to be 1 year, 3 years, or 7 years. The vast majority of claims are given 3 years. 1 year is medical improvement expected. So cases that they really can see that this person's likely going to improve, they're going to have the 1 year. The majority of cases are 3 years. 7 years are really those permanent conditions, but they're required to put that date on. They're not always timely in getting to these. So even though you think, 3 years from now, I'm going to have to do the review, very likely it's going to be 4, 5, 6, even 7 years later before they actually get to you. The first type of review they do, and this is what the majority of them are just what's called mailers, which means you're going to get a form asking you, has your condition changed? And you're going to complete that form and mail it in. They're going to look at it and say, oh, no, nothing's changed. We don't expect it, and file it away, and you're done. For some, though, they're going to see something, or it's going to trigger something where they're going to want to do a more in-depth review. And then they may actually go out and look at the medical records and look at it more in depth to see if your case is going to continue or not. And if your claim is denied, you do have appeal rights where you can appeal, and within 10 days, you can request payment continuation, so that you can continue to get your checks while they go through that process. And then I would certainly, recommend you getting an attorney to help you through that if that came to be. But again, the vast majority of them, that's not going to happen. They actually, very few, if you look from a percentage basis, are people who are actually, told they're not disabled anymore, come off the rolls for that reason. So I know people get panicked and worry about it. Just remember, everybody has it done. The majority of them are just going to be a paper review. Only a few more are going to actually have more of a medical evaluation. And if worst case scenario, you are told that you're no longer disabled, you do have appeal rights that you can go through and then prove that they're wrong and the condition has not improved.
Okay.
Yeah, I think the stats on that, if last I saw, is like 94% of the people are continued after doing one of these continuing disability reviews, or CDRs as they call them. And even if they do, as Barb said, even if they do terminate you, you can request what they call payment continuation while you appeal it. So you'll continue to get your checks while you're appealing it. So yeah, it's not something to freak out about, but it's not something to ignore either. So you want to, if you've had someone represent you before and you get that letter, I would call them and say, hey, I got to be reevaluated. What should we do? Most of the time when I do that, I just talk someone through it and say, oh, you'll be fine. Just say this, that, or the other thing. When they give you that short form that Barb was talking about, they usually ask questions like, have you worked at all in the last 5 years? Have you gone to school? When's the last time you saw a doctor? They're kind of looking for red flags.
Mm-hmm.
So if you said, yeah, I haven't seen a doctor in 2 years, they go, that's strange for someone who's, disabled. Or, yeah, I'm doing some work, or I'm going to college, taking 4 courses. They're going to say, maybe they have some work capabilities. So just kind of be careful of setting off those red flags if you want your benefits to continue.
Okay. I just want to check in to see if we've had any questions or comments. Wonderful.
I thought
We
the
do
audience
have
would
a
be
few
asleep by
questions.
now.
Yeah, I'm going to go ahead and repeat them as they're told to me. Okay, let's go. Okay, so was that FS, F as in Frank, S as in Sam? SS, Social Security. Oh, we have a question from Yulia that says, if someone has had their aortic root replaced, that they may not qualify for Social Security. And I think there's a that was a confusion. What I think I was mentioning, that I think you'll probably explain a lot better, is if somebody has an aneurysm presently or has had a dissection, that even though there was a code for aortic dissection, I remember seeing, it doesn't automatically award you a guarantee of disability. It's more of, because this injury has happened, what are some of the things that you feel you can't do to work? Am I correct in explaining that? Maybe you'll explain it better.
Yeah, no, I think you explained that very well. If they're going to look at not so much what you've had or had done or not, if it's how you are at the moment, and will it last 12 years, keep you from doing not just your past work, but any other kind of work. Because I know a lot of times they just kind of, they keep an eye on things, right? And but there's all sorts of things that come with that, fatigue and whatnot. So they're going to look at kind of the whole person, not just whether you've had, a surgery or not.
Right, because it's not the root being replaced that causes the disability. It is exactly like you said, the multiple medication side effects. It's not even the medication, it's the side effects that may prohibit you from being able to work a full work day. You might need to nap in the middle of the day. You might suffer from migraines from the medications. Those are the things that cause you to not be able to complete or have work performance.
Right, correct.
Okay.
Hope that answers the question.
Yeah. Next. Okay, so a question from Deb. Are payments from disability retroactive if you are denied and then approved?
Correct. Yes, you can have retroactive payments. Social Security can pay back 12 months prior to when you filed. So say you filed in 2018 and then you were denied in 2019 and denied again in 2020 and eventually awarded in 2021. Social Security, when they eventually award you, as long as they found you disabled as of that original onset date, can pay you right back to that original filing date and potentially 12 months earlier, depending upon when your onset date was. So by filing that appeal, you're protecting your original filing date. It's really important to do that so that you can be paid all the way back. Now, I mentioned when are you eligible, so I'll step back a little bit on that as well. If you are disabled from whatever point your date of disability is, with Social Security finds you disabled as of that date, you have to wait 5 full calendar months before you're due a check. So for example, say you're disabled on January 15th. Social Security says, yes, you were disabled January 15th. You have to wait through February, March, April, May, and June. July of 2021 is your date of entitlement. July is when you're due your first check. But say I didn't get awarded until the year 2023. If Social Security found me disabled as of January 15th, 2021, I could get paid right back to July. So I do get all those past months. So remember, it's 5 full calendar months from the date of onset will be your first check date. And then, of course, you are protected as long as you filed appeals up until the point in which you're found to be disabled by Social Security.
Wonderful. Perfect. Thank you.
I'm going to confuse things more. Remember we talked about the 2 programs, SSI and SSDI? Yes. What Barbara's talking about there is SSDI, the one you have to work and pay into your quarters of coverage. With SSI, you don't have to serve a 5-month waiting period, but they do not go retroactively. And let me explain this way. In Barb's example, in that January of 21 is when they become disabled. If you're eligible only for the SSI, meaning you haven't worked and paid into the system, you apply for the SSI, and if they approve you, they pay you right away from that January 21 going forward. But if they take until 2023, they would still pay you retroactively, but only to that January of 21. But with the SSDI, if you, for some reason, do not apply right away and you become disabled in 2021, but do not apply until, I don't know, July of 2022, they would go back 1 year back from the date of filing. But SSI does not have that protection. SSI only pays you from the date you apply. Okay. So I don't know why I mentioned all that, because it's kind of inside baseball. It is confusing, but anyway.
That's okay. No, that's okay. Thank you. Okay, next question. Question from Kurt. Can somebody have Medicare and Medicaid at the same time?
Yes. Yep. They could be eligible for Medicare under, for two reasons, either under SSDI, an award, but they still have low income amounts, so they're eligible for SSI and SSDI. So they need to have both Medicaid and Medicare.
How do you decide what becomes your primary with Medicare and Medicaid? That's got to be confusing.
Yeah. Medicaid usually covers more things than just Medicare does. So Medicaid is the one to have. But I think Medicaid would require you to take Medicare. I think they interrelate that way.
Gotcha. Okay. Any other questions? Okay. Okay. See, this is my pump head. I have to relay this question since not everybody could hear what we just heard. So why wouldn't you receive your Social Security disability back pay with your first monthly check? I guess is the gist of that question.
Yeah,
is that the gist of it? Yes.
Usually when Social Security, if they do everything properly, will pay you when they first entitle you that month's check and everything you do back retroactively. Sometimes if you've applied for both SSI and SSDI, they will withhold the past due and pay you just the SSDI from the date they award you to investigate to see, have we already paid this person SSI? Because they don't want to double pay you. So that might be the reason that I think this person was suggesting that they must have got awarded and didn't get all their retroactive check. And now they're trying to get Social Security to pay that to them. That's, I think, generally the reason they wouldn't give you the retro all at once, that they're making sure you didn't possibly get SSI going back because they don't want to double pay you.
I actually think, and I could be wrong because it was so many years ago, for me, I got my retroactive big check first with the half of my award, half of my retro for my son, who was still under 18 at the time, and then still waited like another month or so before I got my first monthly check, and everything started, because everybody gets it on a different day of the month. You know, it's the fourth Wednesday, or this person gets it on the third. I don't understand how they do that, but yeah. So I still got everything. It was just different timing. It wasn't all together.
It can be a little confusing because Social Security pays in arrears, and what that means is whenever you get a check, it's really for the month before. So the check for the month of August is the check you are paid in September. So when you are getting the retroactive benefits for Social Security, if SSI is not involved, you are getting the check for that month. It's included in it. And then the next month, so the August check isn't paid until September. So you're getting it September. It is for August. So that might be why people think they're not getting that check for that month in that month, because it's actually not due, if that makes sense. It's kind of confusing.
You're getting paid after the month, the month.
Yes. Okay. You have to live every day of the month to be due the check, and that's why Social Security pays in arrears, to prevent overpayments for people who might pass away.
Makes sense. Okay, next question. So we have a follow-up from Yulia. Do connective tissue disorders qualify for disability, or is it case by case? And then she may be referring to well-known conditions such as Marfan syndrome, Loewy-Dietz, Ehlers-Danlos, Turner. There's a lot of different well-known connective tissue disorders out there. Do they by themselves, or is it case by case?
Yeah, they by themselves for sure. They affect the whole body, or the whole body system. So absolutely, connective tissue diseases are in and of themselves a reason for disability in many instances. But obviously, it's a case-by-case basis, because some people could have a connective tissue disease or lupus or something, and they're somehow able to be okay. Other people are very affected by it and cannot work. So it's it's always going to be case by case. You know, you have to look at the facts of the situation. And as you answered earlier, Karen, how it affects you on a daily basis and how it impacts your ability to engage in daily activities and work-like activities, et cetera.
Thank you. Okay, next question. Okay, those are some great questions.
Questions.
Yeah, because I think that the misconception is one way or another that you have been diagnosed with something that you know, given the right amount of stress or all the ingredients, it can be a recipe for disaster, basically, if you work. And so the question is not, and I still agree, I don't think it's the syndrome itself, because as you said, there are still many people that function okay with it. It's not till it really rears itself. And then the question is what damage is it doing? What restrictions has it placed on you by now showing itself? Are you restricted to lifting, and that was your job? You were a caretaker. Maybe you were a nursing assistant and your job has to be able to lift a certain weight, and now you can't do that anymore because of the condition. And so it's really it's not the condition itself, it's what it does to your body that prohibits you from being able to do the job duties and responsibilities.
Right.
And that's really true for pretty much every condition out there, other than really a handful of conditions that Social Security has designated that you can get awarded purely by having, and they're called compassionate allowances. They're conditions you don't want to have. They're severe, terrible conditions. You know, ALS would be one. All you need to have is the diagnosis and you will be awarded. But for almost every other condition, it really comes down to, okay, how is that condition affecting you? And then that is what we go and we try to prove that this person can't work based on these reasons of what this condition is doing and the inability that they have in order to be able to go out to work.
I do have one question. I know somebody in the community who went through everything, got to the hearing, still was denied. This is in another state where denials, I guess, tend to happen often. So what can you do once you've been denied at the hearing level?
Yeah, there is a fourth level appeal within the administrative branch. It's under the Social Security Administration, and it's called administrative law. So we talked about the initial claim, right? Then the reconsideration, second step, then the request for hearing before an administrative law judge. Sounds like your friend was denied through all three of those. Mm-hmm. There is an appeal within 60 days after that judge's denial. You go to the Appeals Council, it's called. And that's an appellate review. Really, you don't have a chance to go before another judge. You can't add any new evidence. Really, you make arguments and say like, hey, the judge, didn't follow the law, or they misapplied the facts, or they misstated something. The judge would have to make a mistake that is clear and in the record. And if if the Appeals Council agrees with you, they can do one of two things. They can either award your case outright. That happens very rarely. More than likely, the positive effect is that they remand or send it back for another hearing to the judge, kind of saying, hey, kind of fix your mistake here. Then you kind of get another bite at the apple. Okay. But let's say that happens and you go to the Appeals Council and you get denied again, which does happen. That means you've been denied 4 times at the Social Security Administration level. You then can go ahead and, if you feel your case has merit, you can file a case in federal district court, basically suing the Social Security Administration for not following their own rules. And I often say it's a pretty good country where you can apply for disability benefits through the government and they deny you, and then you can go ahead and, quote, sue the government saying, hey, we're going to seek judicial review of what of the law that Congress put in that you didn't apply properly. And for those cases that we take onto that, we have a pretty high award rate because every once in a while it just happens where, someone gets denied the initial, the recon, and then they draw a bad judge, or, and they make mistakes and you point it out, and they miss it again at the Appeals Council. And so it's a lot of work, but it's very satisfying when we take those cases to federal district court and get them completely overturned. And those often are difficult because they get a large retroactive check going back for 5 or 6 years, but what have they been living on the whole time? Nothing.
Right.
So
right. Exactly.
It's kind of bittersweet to get the win, but it's would have been a lot better if it got awarded at the initial level.
Exactly. I'm just going to check in to see if we have any more questions. Okay, we have a satisfied crowd.
One more thing I was going to mention, Barb, remember you were talking before about the problems with Social Security. The one thing we didn't talk about is the phones. They remember Social Security used to be able to go into your office, and a lot of people go in and they bring their applications, they have appointments, but you can't go into Social Security offices anymore. So of course now what's happening, everybody is calling in, and because of that, they don't have the manpower or the phone systems or whatever. You can't get through to them, and you can leave messages. You're not getting called back. They're being overwhelmed. Barbara, at one point you had the numbers on that. Wasn't it some absurd amount?
It was absurd. It was like something like the calls had increased to like 1 million a week, in terms of what they're doing. So they're spending so much more time now on the phones that they can't be actively working your cases, because they actually opened up more lines. So they had to put more lines out there because nobody was going into the office. Everybody's calling. So all of those claims representatives that were at their desk doing interviews now are answering the phones as well. And with additional phone calls coming in, you can see how productivity has gone down because they just don't have time to do the work. That's a great point, Chris, because that is another large factor in why things have slowed down so much, is because they just can't handle the amount of work that needs to be done doing it the way that they're currently doing it. Is
there a way, because gosh, before COVID, I used to love going into my local office. They're so nice, they're so helpful. Between calling them or calling Medicare, I never had any problems. I just thought everybody seemed very patient and understanding. So what can people do if they can't get through on the phones anymore and you really have a question? Where can you go to get those answered?
That's a problem we struggle with every day because, we often cannot get through, and we do this every day for a profession, right? And sometimes we get secret numbers we keep, and we know someone and we say, can you do a favor? We don't want to use them up either because, you can't go to them all the time. But seriously, if you cannot get through to your office at all, and, you've tried many times over the course of weeks and you're not getting through, or you're leaving a message, no one's calling you back, what I would recommend those people to do, and they really need something that needs to be addressed, is I would make what they call a congressional inquiry. I would call your representative in the House of Representatives or your senator's office, whoever you happen to support, and they have a constituent services division where they will look into government service if they're not getting to you, and just explain the details and I've been trying to call for 2 months or whatever it is, and I've been leaving messages, no one's calling me back. They sometimes will make an inquiry, and then they'll get through, and someone will, answer your call. But I wouldn't do it after, for just something simple. But if you're having a major problem with getting something resolved that's very important and you're not getting anywhere, I would try that.
Okay. And before we go, because I don't think we have any other questions I have been notified of, I want to have you take a moment to let the community know if they want to reach out to your firm, what they can do directly to do that. Because you work everywhere. Just because you're based out of Massachusetts, New Hampshire area, you really will have anybody that can go anywhere to help people.
Exactly. Yeah, we have attorneys all over the country that work, and employees and work for us, and we have 100 employees. So we represent people in all 50 states. Puerto Rico. We had someone in American Samoa. We did a hearing recently on the telephone. I said, shoot, I wish we were traveling. I'd make a trip there, right? The old days for the hearing. Anyway, so our office phone number is 800-211-4736. You can call us anytime. You can ask for Barb or myself. If we're not there immediately, we'll always get back to you. Barb, do you want to give them the...
Sure. And also, if you want, first off, all of our contact information is on our website, and our website is www.dcklaw.com. So dcklaw.com will have contact information to how to get in touch with us. You also could email us. You probably won't remember this, but you can also email us through the website. My email is bmountain@dcklaw.com, and Chris's email address is Doherty@dcklaw.com. So dcklaw.com is probably the best place for you to go in terms of getting contact information, learning more about us, and then making that phone call. And then we're happy to talk to you and see if we can help you.
And we will make sure we have all of that information posted below, exactly where people are supposed to like and subscribe so that they can find about events like this that are happening tonight. Thank you so much for being with us. It's always, as I say, it's probably one of the most important live events that we do here at Aortichope, next to when we talked with a surgeon. I think we're so overwhelmed with starting this process, and it's such an important, as you once said, Barbara, we're just tapping into the insurance plan that we set in place when we started working, and we're just putting our claim in now to be helped a little bit during a time when we can't work necessarily. So I appreciate you taking time out of your evenings from your families to sit with us and go over all of this information. It really does help the community at large. So thank you.
Great.
Welcome. Karen, you've learned so much. I'm always so amazed at how much you remember. You could do this yourself now.
I read, except I couldn't remember SSDI versus SSI. I was like, why was my head stuck on Medicare and Medicaid? I don't know, but that's, I do, but I love that I learn every time we talk. I sit here and I'm just like, oh, I don't look like I'm just gazing, but it's, I received disability, and it's something I'm always in touch with my doctors and my therapists. We talk about it. We're very frank about it. And I hate seeing people struggle. I've hated it since the day this happened to me. That's why this organization was born, and being able to connect with people like yourselves to help make things a lot easier for people is really what we're about. So again, I appreciate you guys both. I really do.
Thanks for having us.
Thank you. And thank you, everybody. Hope you can join us again later this week when we interview Dr. Fisher. Don't forget to like and subscribe. Take care. Thanks again.
Bye.
Bye, everybody.